Dr. Alessandro Maiocchi. He is the Director of Discovery Department from Bracco Imaging in Torino. And he's talking today about nano micro-size contrast agent for imaging application, the critical factors for their clinical translation.
Okay, so thank you, Christoph, for your kind presentation, and good afternoon to everybody. My presentation now today is related to a discussion about possible critical factors and clinical translation related to nano and micro-sized contrast agents. So it's a general overview about what I have understood, or at least what I think to have understood about this specific area in which very often we are talking about innovation in a very common way. Now, it's not so common, this kind of stuff. So which one? Okay. Up. Big green. Big green? Okay, thank you, sorry. So innovation is something that permeates our current healthcare knowledge, because any one of us exerts more or less one time by day notice regarding a very new breakthrough innovation in medical care. But unfortunately, this is not always true, because innovations sometimes do not fulfill some of specific rules. First of all, innovation do not meet real clinical needs, and they cannot be translated in practice in clinics. So very often they don't offer the possibility to change some things in the clinical practice, improving the patient management, and also improving the way in which medicine is distributed and practiced. Again, innovations means opportunities that could create, a better outcome for the patient, possibly also cures. And this is not very often fulfilled, and this is the reason why many companies also cries a little bit about the fact that they don't have enough return of investment from their products. So inside the imaging field, in clinics, imaging can offer a lot of possibilities, at least in principle. Today, the most part of these offers are related to diagnosis, but we have also seen, particularly in combination with nano-sized systems, that this first area of interest of imaging moved in different clinical areas like surgery, biopsy, therapy, and also drug delivery. And this is one of the topics that I will discuss today. So imaging modalities are not all equals. So each one of them has its own pros and cons, and particularly a different resolution, depth, and sensitivities. And so it means that depending on the specific objective, we have to select at least one of them, or a combination, a complementary combination of them. Not necessarily all these methodologies are perfectly fitting the requirements for nano-sized or micro-sized system. So also different type of applications, from anatomical, physiological, but also molecular imaging. It is very common, but at the same time, we have differences in the amount of tissues that we are considering. So moving from something quite larger, from 5 to 10 millimeters, and to 1 millimeters of H. And this is a very big difference because, for example, in the first case, anatomical or physiological applications, we are talking about lesions that are very, advanced, with certain limited possibilities to intervene. But when we are talking about molecular stuff, so when we want to see and observe changes, abnormal changes in the tissues and cells before some specific morphological changes occurs, we need to enter more in details in the biology of the cells and the tissues, generally speaking. But this is more complex. Anyway, nanoparticle can, in principle, offer some opportunities here. So in molecular imaging specifically, because it is possible to build up systems having the possibility to recognize specifically some epitopes that should be related to a specific abnormality, and amplifying this event, specific biological event, with several imaging probes that can be collected into around the nano-sized object, or at least having the object per se with a very high signal that can be recognized by the right receiver. So, to be honest, in imaging, as we have seen before in a previous lecture, there is not so much nanoparticles already on the market, today on the market. And the only one that is surviving a little bit is Ferumoxytol, that we have already heard before. Ferumoxytol is used today sometimes in US, especially in pediatric patients, or for patients having impaired renal functions. This is due to the risk associated to the usage of gadolinium-based contrast agents in this specific subpopulations. Anyway, you can see and you can clearly observe that there is some difference between gadolinium contrast agents and Ferumoxytol, for example, in an angiogram like this one. So there are some limitations and the possibility to translate Ferumoxytol in an angiographic product is quite difficult due to the competition of something that is already in place in the clinics. So not everything can replace what is already used in the common practice. Moreover, there are some additional complexities related to the fact that nanoparticles are not, so prone to enter deeply into the tissues. And indeed, several studies shown in the past that the accumulation of nanoparticle in cancer, for example, is not so straightforward. There are some limitations on that. And indeed, many others debate about the fact that perhaps there is something that is not perfectly working with nanoparticles. And one problem is the permeability that can be very different case by case. The other problem is related to the interstitial fluid pressure that create a barrier towards the permeation of the nanoparticle inside the tissue. And the combination of these two, at least these two major effects, could create a result like this one. This is a nanoparticle charged with, uploaded with gadolinium, and this is an MRI with different slices of a tumor. And in this case, the nanoparticle was also decorated with a ligand recognizing a specific receptor, and folate HER2 receptor. And what we can observe is that distribution is completely heterogeneous. And this heterogeneity is related to the resistance to the transport of nanoparticle inside the tumor. Now, which kind of diagnostic implication can be derived from an image like that? This is quite difficult to say, also because the image coming from small molecule are completely different, and the clinical practice today is based on this standard care and not with this one. So anyway, it means that we could consider this information as a measure of limitations in the transport, in the transport process, and in this way we can also try to predict which kind of behaviors could characterize a nanoparticle, at least charged with or uploaded with a drug specifically. Also, we know that it is possible to change some things in the physiology of the tumors. This is an example of a clinical studies in which the authors here demonstrated that the treatment with paclitaxel can change the interstitial fluid pressures. And indeed, we made some, in collaboration with the Mario Negri Institute, we make this kind of study in which following or observing the increased permeability due to the treatment with paclitaxel of a tumor, we can increase the amount of antibody entering into the tumor, and at the same time also we changed the response of the therapy, moving from something that is almost not working to something that is very highly potent. Again, we have some additional concept related to the possibility to use microbubble in the microsite system for doing molecular imaging. This is an example of VEGF-R2 ligand. VEGF, yes, anti-ligand for the recognition of VEGF-R2. And in this case, it is possible to analyze angiogenesis with a system like this one, in which we have essentially a microbubble and some ligands decorating the surface. What we made in the past, but also in the new, maybe for, oh, no, sorry. No? This one? Okay, thank you. So we made an improvement in a previous characterization and moving towards clinic with this kind of system. At the beginning with prostate, and now we have also evaluate results in breast cancer, and the results were quite interesting in the sense that we were able to visualize ductal adenocarcinomas and discriminate adenocarcinomas versus benign fibroadenomas, for example. And again, maybe that the time is up, so these things is not working more. Huh? It's also temporized.
Time restricted.
It's time restricted, yeah. So this is just a time course of a tumor, a human tumor here in breast cancer, and so we can see that for a long time this accumulation of microbubble remain in the tissue. Good. So this is a one way to look at, perhaps, okay, one way to look at different opportunities offered by microbubble platform. I don't want to enter too much in both of them, just to say that for diagnostic we have several possible alternatives, just changing the nature of the ligands on the surface, but we can also use different schemes in which we can add DNAs, we can add liposomes around, we can also include drugs, and we can just use microbubble like this one with special properties, so that with these special properties we can do something that is very important, at least from my side, and I try to move on this side very soon, that is just to improve the permeability of the endothelium. And improving the permeability of the endothelium in the combination of microbubbles injected into the bloodstream with ultrasound with appropriate acoustic pressures, we can improve the drug delivery. And this is one example of a system that is using a microbubble like that with a device developed by this company. And this device is just providing the ultrasound, unfocused ultrasound in the brain for those patients that are treated before by surgery. And then inside the school, they put this kind of device, and then they can combine microbubbles, ultrasound, and also the drug. The results of our first clinical study was quite interesting, somewhere, okay? And we can observe at the end that there is here, this is the point in which the plant was being posed, and this is the beam of the effect of the beam of the ultrasound in combination with microbubble, increasing the permeability of the blood-brain barrier. So this is a scheme that can be, of course, also extended to many other organs and solid tumors in order to improve the efficiency in this, also in this way. Yeah, sorry. Okay, so just to move to the conclusion, nano-sized imaging probes can have some potential, increasing sensitivity of imaging modalities from one side, but also improve drug delivery procedure, quantify extravasation heterogeneity. So it's a sort of possible companion diagnostic opportunity in this sense, and also guide drug delivery procedure with combined therapies when we get a look on what is the effect of some therapies on the permeability induced by the treatment or pre-treatment before the injection, for example, of a nano-sized drug. So while with microbubble, we can obtain good diagnostic performance for molecular imaging procedures at relatively low cost. And molecular imaging is generally done only with nuclear medicine today, with the exception of microbubble and ultrasound. Again, just the last but not the least, micro-sized bubbles can enhance drug delivery, and this is very important stuff for me, improving endothelium permeability and perhaps also the increasing the bioavailability of the drugs, nano drugs or drugs generally speaking, to the site of interest, hoping for a better potency and better response for the patients. Thank you very much, okay. And sorry for timing up.
So, Alessandro, thank you very much for this really very interesting talk. There's time for one short question from the audience. I would like to ask concerning the sono drugs. You showed that you can reach also with the sono the deeper body spaces in the brain. Normally, but according to my knowledge, mostly superficial areas are better reached by sono directing. Or am I right, or what do you have? What experience do you have?
No, so microbubbles are moving in the bloodstream and simply everywhere, I mean. And just applying at the ultrasound, we can locally, only where the ultrasound is focused, can improve the permeability of the endothelium. In this way, we can observe this improvement in the permeability by MRI, just adding an additional element that is a contrast agent. So we can observe, in that case, an increase of the signal coming from the usage of this molecule.
I see. Okay, but I mentioned this much more, that this ultrasound is restricted to superficial areas. That means you have to have a specific sono
no, not
device.
No. In that case, it is used because skull cannot be passed because it absorbs a lot. But for another kind of organ, you can use ultrasound with also common clinical probes.
Yeah,
okay. So it's only for skulls that there is this limitation.
Okay, thank you very much again for this really interesting talk. Now I would like to announce the next speaker. It is